What can you tell people that can make you orgasm, right?
Explore yourself first. You get to be comfortable with your body first. Use sex toys. Use your fingers. You should explore yourself first, and then for women, many of us can orgasm through clitoral stimulation, not only from
Penetration.
Yeah.
Ironically, I attend a seminar. I am a speaker. I asked a question to the audience. Where did you learn about sex the first time? Mostly will answer from the porn site. For me, sex education is really important because it can help your life. It sounds extreme, but in real case, there's a couple that get divorced just because they don't want to talk about sex and they don't want to be open.
Scoopy Gang, welcome to the new week, and today we're talking about sex health.
Why you have to laugh?
I mean, I was nervous. Okay, guys. This is Dr. Michelle and Dr. Joe, and today they're very specialist in general practitioners, right?
Yes.
Yes. But you guys more focused on sex education.
Yeah.
Yeah. But did you guys study? Did you major in sex specialization?
No. Well, sexual health and reproduction health, some of it is general practitioners' competence, and I myself attend some seminars regarding sexual health and by practice, day-to-day practice.
Actually, you will be own a clinic in
yes.
Bali that focus on sex advocation and sex health, right?
Yep. I'm building a sexual and reproductive health clinic in Bali and Korobokan. Pray for me.
We pray for you because one of my friend asked the question about where do you find good gynecologist in Bali? It's one of the hard things to find in Bali, is it?
Yeah. Mm-hmm. Well, and everywhere else actually, it's quite a trial and error for us. Women to get a good gynecologist.
Why? Because people don't like to go into that education and practice that.
It's a very personal, relationship to your doctor. Trust. It's it needs to be built, not just by one-time visit.
Okay, because back in US when I mean, of course, I'm not woman, but I did dated women. They usually able to find. I mean, I understand because it's most comfortable thing. Are you comfortable with the doctor or not? But there is so many options you can find back in US. Why I feel like it's not existing here? That's why people struggle to do that. Is it because they're not comfortable, or is it because there is not a lot of doctors?
Maybe for Bali, specialists are heavily located in Denpasar area, not in Canggu area. If you think about it, we have to go to Sunset Road. I won't name the hospital. It's the nearest hospital. We all go, and the distance.
So you gotta get out of Canggu.
You gotta get out from Canggu.
Any doctor specialized you can name that people can know?
For fetal-maternal, it's Dr. Teguh. Teguh in Renon.
Okay.
Maybe we can.
Yeah, we can keep it in the description. Yes.
Later.
Okay. And how is the education for sex here? Like in general, if you want to get majored in, or in general in the school system?
It all started in the most intimate family, but Indonesia is a very religious country, so it varies. And then the school system, the curriculum, sex education is not standardized yet. So it may vary as well.
Okay.
Since Indonesia is really conservative, especially towards this topic, and we did learn sex but we only learn the function, we only learn the anatomy, but we did not provide with such a, such information in regarding the activity,
Okay.
since it's still
Taboo. Yeah.
from nowadays. The ironically, I attend a seminar and I am a speaker, and then I ask a question to the audience: where did you learn about sex the first time? Mostly will answer from the porn site.
Okay. Just okay, but it's not. It's banned here, right? So
It's banned, but you can still access it.
okay.
And then it ironic because they learn from the false information.
Yeah, because it's not true.
They
Yeah.
tend to have a wrong perception about sex. And then ironically, there's a teenager, a woman, that said he learned to use tampon.
Okay.
Tampon.
Tampons.
Tampons.
On the porn website.
From the porn site. That's
That's not good at all.
yeah.
Yeah.
That's why I think in Indonesia there have to be someone that really advocate and teach about sex in the correct way.
So how do you think we can solve that?
Since now the social media is the main source when you want to search information. That's why I jump into sex education thing. I think, is that the same reason for you?
Yeah. For me, is because when moving to Bali, working as a doctor in where my patients are 90% are foreigners, that opened my eyes completely. Like in before when I was still in education, there's no sexual health related patients. There's not much.
Okay.
And it's very heavily stigmatized. If someone comes with an STIs, she's a sex worker.
Yeah,
Oh,
okay.
she's it's a degrading. It's a stigmatized.
So do you think people still don't go to the hospital even they get STIs?
In Indonesia,
Yeah.
I think most of it, yeah.
So but that doesn't treat the STI. So you
Yes.
just tend to live with it?
I have an experience before. There's a woman having STIs, and then as a doctor, we usually advise her to bring her partner. She's married, and she refused to bring the partner
Okay.
because in medical there's a term called ping pong phenomenon.
Oh, what is that? I didn't know.
When
If you treat one partner and the others don't,
and they still do sexual activity,
And still you can get it, right?
Yes.
Yes. Yeah.
and it's gonna like back and forth
Yeah.
infection with never ending
Yeah.
solution.
Yeah.
That's why in medical, if a married couple have STI, we usually advise to bring their partner and also get treated.
Both together same time, yeah.
Yeah.
well, it's not limited to married couples really.
Yeah.
Any even a single a patient that is single and their status, they still maybe date someone on casual basis, right?
Yeah.
And we should alert the partner as well. We can maybe as a clinic tell the partner, hey, we have a patient. We won't tell the name, but you should get treated because this patient is positive for XYZ.
Okay.
Yeah.
And why do you think she's didn't want to bring the husband?
Maybe it's outside the.
Yeah. Because I think it's a personal reason.
Okay.
Maybe like she has like
Affair?
some affair.
Okay.
And that's why but it's different when I have a patient which is a foreigner. They really open about this kind of things, the ping pong phenomenon. They already know. They bring the partner, or they will hold the sexual activity for some period of time, for example for a month, just to not spread the
disease to someone else.
the infection
Yeah.
to their partner.
Yeah.
It's really different based on the understanding of what STI is.
What is the most common STI you guys see?
For me, it's gonorrhea and
Gonorrhea.
syphilis.
Okay.
Quite the
Gonorrhea
same.
and syphilis. I'm not familiar with those.
Um,
Can you describe what they
Okay,
are?
gonorrhea is a bacterial infection that can cause multiple things in our reproductive system. Um, Maybe the the non-medical term in Indonesia is kencing nanah or
Okay.
pus, where you pee as like a pus,
Okay.
but it's not the case.
Okay.
It can be no symptoms at all.
Yeah.
And
Okay.
that's why we need testing regularly if you're sexual active.
Okay. But if there is no symptoms, that means it's not affecting your health. Is it still affecting your
it's-
health?
It could.
Not necessarily have a symptom,
Yeah.
but some people do have a symptom, like, when, for us, a man, when you pee, it's really hurt, and there's like a discharge,
You call
yellowish
UTI.
discharge.
UTI, no?
It's a different.
It is
Okay.
the different thing,
Okay.
because UTI is usually caused by E. coli,
Okay.
in some kind of bacteria that we have in our gut system, in the digestive system. But for gonorrhea, it's caused by a bacterial called Neisseria gonorrhea.
Okay.
And most of the case that I had, the man will like say in bahasa, saya kencing nanah nih dok, gitu. I have a pus in my
P.
P.
pee.
Okay.
Yeah.
Pus is like a yellow color.
Yeah, the
Yeah,
discharge, the yellowish discharge.
Okay. It's like a darkest yellow or like a normal yellow. Sometimes when you get dehydrated, you get
Oh no
yellow.
no. It's a thick
It's a thick
mucus.
mucus.
Oh, okay.
Not
Not
like a
not the
water.
urine. Not the urine is yellow, but the thick mucus.
In,
That's like it's like
you know, like infected wound.
it's like that, like some.
No, like the ooze when you have.
Do you know infected wound? When it gets
Oh yeah,
really
it gets
dirty,
yeah.
kind of like that.
Yeah.
Okay.
To put it simply,
So how do you treat it and how do you prevent it?
How do you treat it?
antibiotics.
Antibiotics. Okay.
Yeah,
but,
basically by a shot, maybe, or an oral.
But like once you take the antibiotics, the like imagine your health becomes normal, but sometimes when the stress levels increases in your body, like anxiety and stress, it brings back the
Oh, it's a different kind of STI.
Yeah.
Okay.
It's herpes.
Okay.
Maybe.
It-
Herpes cannot really leave your body.
okay.
It stays dormant or sleeps
Okay.
in your nervous system, and it could be
Exacerbate. Yeah.
brought up again if you're stressed and your immune system is low.
It's HSV1 and HSV2, right?
Yeah. One is for genital, right?
One is for the
Sorry.
upper body or something, no?
Now, there's a lot of STI.
Okay.
The you say one or two, it's syphilis.
Okay.
It's of herpes simplex virus, and it can infect your genital. It can infect skin. It can infect your mucous system, mouth. And one thing about STI, some STI actually can complicate and can go to your brain.
Okay.
So that's why it's dangerous.
Okay.
I don't say it's most of the case, but some cases can be complicate or have a complication and can increase your can reach your brain.
Brain functionality can
It can infect your brain.
okay.
That's why it's really something that you have to aware of, and something that really important.
So the only disease which comes back with anxiety on like your body health system is herpes.
Herpes.
Everything else can be
HIV and syphilis is also HIV is controlled.
okay.
So the drug, the antiretroviral drugs, it will suppress the viral load. So if it's controlled, you cannot transmit it.
Okay.
So undetectable is untransmissible. And then syphilis is also you need to check regularly for the antibody and the antibody. It never leaves your body as well, right?
Okay, so most of the STIs, once you get it, and it's hard to
The famous one.
the herpes, syphilis,
Yeah.
and the HIV.
Yeah.
But is there a drug for HIV yet? No.
Antiretroviral.
Okay.
It only suppress
Okay.
control, not eradicate completely. Like there's no HIV, there's no virus at all.
Anymore. Yeah.
Okay.
But some research these days they use, I don't know, I read it just yesterday, or stem cells. It can be promising, but it's still
Okay.
under study.
It's the same like cancer, treating your stem cells.
I have no idea about this because this is kind of new.
Okay.
But there's also a novel treatment, a new treatment they still develop, like a vaccine to really eradicate or make the HIV gone. But I think it's still far away.
Yeah, it's still
It's
under
sti-
study.
it's
But
still under study, it's
it's
still
a
far
promise.
Okay. So how do you prevent it? Most of this STIs, like a
Safe
simple
sex.
basic rules.
Just
There's
a
only
safe
one
sex.
thing: safe sex.
Safe
Safe
sex.
sex.
practice.
Like how do you practice safe sex? Just condoms?
First is of course no what do you call it? Abstinence is also is one of the prevention, but it's not
Really works in real life, especially when
it doesn't really work. Abstinence is just number one.
I'm confused. What is the abstinence?
Yeah, when we talk about safe sex, there's actually a couple of steps that you can do.
Okay.
The first one is abstinence, no sex at all.
Oh,
But
okay,
you
okay. That
cannot
doesn't work,
Yeah,
right?
it doesn't work.
Yeah.
Usually in Indonesia,
Yeah.
especially when we teach about safe sex to like elementary school, junior high school, or like high school student, we always have to mention abstinence as the first
Line.
Okay.
line of safe sex.
Okay.
And then there's also condom.
Okay.
Condom is actually the only contraception that not only can reduce your chance to get pregnant, also can reduce the risk and prevent the sexual transmitted disease.
Yeah.
So condom is the only one contraception.
Okay.
And then stay faithful.
Step.
Stay faithful. It means like
Say so. Don't have sex
Monogamous?
outside the marriage.
don't have multiple
partners at the same time. But like, it's still you're having sex with one person, so you could get it, right?
Yeah, actually,
Well, you never know your
Yeah.
partner's
Yeah.
history, right?
Yeah.
it goes both ways for
Yeah.
both of the partners.
Yeah.
If the woman have to
So
be,
communication. You
yeah,
said.
yeah,
You just tell what do I have, like
Test.
yeah,
Yeah.
yeah.
Both of you get tested.
Yeah.
If you have more than one partner, then get tested more regularly, like every 3 months or every 6 months.
Yeah, this is one of the things I'm like, because back in US, I go tested every year. First of all, for primary for your physical health, and they do blood test. It's a separate STD test they do. So how often people get primary testing for all the other diseases?
This is this is actually interesting for STI.
Once you get sexually active.
Yeah, well, we only can advise people to do tests annually, but it's not like in the first line of screening in Indonesia, right? You can get examined if you are willing to get examined. So it's really based on self-conscious, not something that already mandatory or planned.
Not only that,
That's
like
the differences.
even the primary one, like how many people are willing to go to a hospital and do your physical examination every year? Not only for STDs, it's general thing to do every year, right? So like I go tested for my blood and urine, and I get tested for all their diseases and my
medical
sugar levels.
checkup, right?
Yeah,
Medical
medical checkup.
checkup.
Yeah. So how often you see people regularly doing it here?
I don't know the exact statistic, but I think it's really low.
Yeah.
Yeah.
So would you recommend that like getting normally tested, not related with STDs, right?
Ideally.
Oh, yeah.
Yeah.
I do.
Ideally.
Yeah.
I do.
So please check your every year your medical examination. Nothing related with sex, but like at least your physical examination, right?
Yeah.
Yeah, there are a lot of disease and non-communicable disease.
Yeah.
And that should be
So you wouldn't know the symptoms unless you go tested. Like
Yeah.
one of my
as simple as cholesterol.
yeah. So one of the person I known recently went for like get the fluids in, and the doctor do blood test.
Uh-huh.
After doing the blood test, they found out her hemoglobin cells
Low.
are very low, and the person has to fly back to her country
Yeah.
and treated.
Oh.
So if she haven't went to the hospital, she would have never known that. Right?
Yeah.
So that's a dangerous thing.
Yeah.
So I think getting your medical examination done very like often enough
Yeah.
to know how you are doing is
Yeah,
good, right?
absolutely.
So one of the things is the contraceptions. So I know condoms are the first ones, right? But how often people are using condoms? Yes,
That's
one
a
of
question
the
that we cannot really answer.
Yeah.
it's like that's one of the things, like because once you get married and men don't like to wear condom, I think, right?
Not really.
Not really.
Well, at least for me.
Your husband. I think you should ask your husband. Since I'm married, and I do really have a conscience about the importance of condoms. I use it on regular basis now.
Yeah.
Every time I do sex with my wife. Because I have kids now, and I'm postponing to have the second kids because my boys still less than 1 year olds. Yeah. And there's a varieties of condom now. Actually, there's a condom that also become a sex toys now. You know.
Oh, really?
What we can address it like
enhancing.
enhancing. Yeah.
Okay. Enhancing your pleasure? Or-
Enhancing
You can call
our
it that.
partner pleasure.
Oh, okay.
You know.
Okay.
And for me, I sometimes get aroused when my partner get aroused.
Yeah.
So it goes both ways for me.
Yeah.
Not directly, but
Yeah.
you know.
Okay. So what about the women's side contraceptions?
Aside from STIs, the contraceptive, there are also pills.
Okay.
But I myself.
But pill is not recommendable, right?
Why you say that? Why you say that?
Because I mean, it's a dangerous way. If you take the pill and you bleed out, right? The first one is like if you do it, there is like Plan B.
Oh, okay. So pills.
Yeah.
Okay. There's two types of pills.
Yeah.
There's combination pills or
Okay.
the progesterone only pills and
Okay.
the emergency pills.
Okay.
These are all hormones.
Okay.
Okay. I myself tried this pill.
Yeah.
It does not really work to my body. See.
Okay.
Yeah.
Okay.
It's there are a lot of side effects.
Yeah.
Maybe you boys will not know.
I know. But I cannot feel it, but I know.
I can feel it, but oh my god,
I
it's
think I know.
like
It is.
I
weight
made this
gain,
mistake once.
weight gain and
mood. Oh my
mood,
god.
and then acne,
Yeah.
and then sometimes you get hyperpigmentation
Yeah.
in your face, right?
So if you take let's imagine Plan B. If you take Plan B, does that decrease your chances of having a kid in the future?
Okay, for the Plan B, the term that you use, Plan B, maybe it's emergency
Yes.
pills.
Yeah.
It's emergency.
this
It's a 72-hour pill, right? If you like accidentally orgasm inside a woman.
Yeah.
And
Ejaculate.
ejaculate. Okay. Okay. Ejaculate inside a woman, and there is a pill for before you take it within 72 hours to prevent having a kid.
Actually, there's two kind of pills like Dr. Michelle already mentioned before, the emergency pills that you take 72 hours after the ejaculation in 72 hours, and then the pills that you consume on regular basis daily.
Oh, that is different pill.
Plan B is an emergency. It's only just once.
Yeah, if you're not on that daily pill, and then if it happens, then you take Plan B.
Yeah.
So
you don't take the emergency pill on a regular basis.
Exactly.
It's the dose of the hormone is just 5 times of the regular pill, so it will.
So my question is, like, if you take a Plan B at least like 1 time or like 2 times, like how does that affect a pregnancy in the future?
Oh, okay. It only works to prevent that month cycle ovulation.
Okay.
And the progesterone. It is a progesterone based pill.
Yeah.
It prevents the ovulation and it thickens the mucus, so it reduces the chance of pregnancy. But if the fertilization if you're already pregnant, it won't affect the pregnancy. It won't terminate the pregnancy. And if you only use it just once or twice a year, you will be fine.
It doesn't affect your reproductive system in the future of having pregnancies.
No, because it works temporarily.
This is a misconception then. So what I heard from my friends is like you should not take Plan B multiple times. It affects it affects your pregnancy in the future.
Multiple time in the short term.
Yeah.
But you can take like Plan B, like if you do it like 2 times in a 3 months or 2 times in a 4 months. It's actually not really disrupting.
There's no real guideline on what's the maximum amount of Plan B.
Yeah.
But if you're using Plan B every month, then you should reconsider other option. Then Plan B is not really a good option for you.
That's a good thing.
But the main thing is like Plan B in the long term, it does not affect your pregnancies.
No.
So one of the things I heard from people is like you should not do that. I mean, if it happens, right? What else? There is like a thing you call it sponge, right?
There's also injections. It's also hormone based, and then there's intrauterine device. That's like the device like T that it put in the uterus.
Yeah.
Actually, it's also there's a 2 type of it. The one that
one like
with
a circle.
hormone, with hormone and without hormone.
Yeah, because I know a couple of girls like back in US, it's not here. They used the T.
The T.
And also they used just a circle. It's like it has a condom top, like a rounded thing.
I think I know what you mean, but it's not.
Actually the T. It's actually the T. I have saw that kind of. It's actually IUD, but it's only
IUD.
different type. Yeah.
Okay. Because when I use T and I can feel it.
Yeah, because there's like a strings that left like 5 or 10 centimeters from the cervix opening.
Yeah. So like these are very effective contraceptions. Is it?
For a long term, if taking a pills and then having a shot every month is something that you it's if that you not prefer, you can take IUD because once you put it in the uterus,
it's a convenience.
It's convenience.
Okay.
You can you
don't have to set an alarm to take every now and then.
Yeah.
Every morning. That's a morning pill, right? So every morning you take.
Not really.
Not really. Okay.
It depends on the person.
Okay. So mostly use condom.
Because it's non-hormonal and it can prevent STIs.
Yeah. And also it prevents having a unwanted pregnancy, or how do you say it nicely?
Unwanted pregnancy. That's fine.
These are the things I feel like more people people. One of my friend asked, like, does people like why most of the people not using condoms anymore? Because sometimes it's different pleasure. You're not using the condom, right? But it is recommended to use the condom.
Does it worth the rest?
That's the big question.
That's the big question.
So I'm
worth
not.
it?
I'm not sure this person is experiencing not really using condom. One of the question also. I mean, as a man, I know this is very hard, right? So most of the women, even in this day and age, don't know how to orgasm.
Okay.
So this is the biggest thing, right? So what can you tell people that can make you orgasm, right? This is really biggest thing. Like even I experienced it in the women I dated. They don't know how to do it, and they take time or they take very comfort. It has to be like at least a month or 2 months of practicing sex, and then they know how to be comfortable with the person. So
maybe aside from religion, we're not talking about religion here, okay?
No.
Explore yourself first. You get to be comfortable with your body first. Use sex toys. Use your fingers. You should explore yourself first, and then for women, many of us can orgasm through clitoral stimulation, not only from
penetration.
Yeah. That's the case.
Okay.
Me? My turn?
Yep.
I hope you talk a lot on this on this particular question, because we have to know what women want, right?
Yeah. So I mean, if they don't tell me, I don't know.
Yeah, communication.
So, communication is also very biggest thing in sex, right? So
there's a lot of things to say regarding this. The first one, do you think size matters?
Size matters? I don't know.
Yeah.
I have.
Medically speaking.
Yeah. I see what I heard from women. It doesn't matter. So
And
that's all I know.
And it's true.
Yeah.
Because medically speaking, the length of vaginal canal, it's only 7 centimeters until 14 centimeters when a woman aroused. And do you know what is the average length of penis in
Indonesia?
No.
Asia.
Worldwide?
Worldwide average 4.
It's 13 centimeters.
What is 13 centimeters? It's
US.
inches. I'm inches, guys.
Inches is around 3 until 3.5 inches.
Okay.
3.5 inches.
Okay.
And the vaginal canal, the length when they arouse, the average is 4.5 inches.
Okay.
3 until 4.5 inches. That means the average size of a man penis is enough. What about when you have like a condition, for example, a micro penis? Micro penis is when you have a size below 2.5 until 3 inches. Below 3 inches. But the fact is, and this is an interesting fact, there's a lot of experts saying the point of pleasure for a woman is only 4 centimeters or only 1.5 until 2 inches after the vaginal opening. That means...
Because the G-spot is up there, right?
Really close to the opening. That means even a small size of penis is enough. You know?
Yeah.
So it's actually... And there's a lot of misconception about what men should has.
Okay.
Because it's not really size that matters, but the hardness scale. You know, when you there's a lot of hardness. Do you know what hardness scale is?
Like how hard is the blood flow through your?
There's sometimes you hard, but you're not hard enough. It's still like, you know, soft in the inside, but hard on the outside. Yeah. That's what matters actually.
Okay. The size doesn't matter. What about the thickness?
The thickness, I don't really have like medically data about the girth.
Yeah.
But some people say it matters. Some people say it doesn't matters. But in terms of orgasm, I have a data that only 30% of women have orgasm from penetration. The rest, the 70%, is from other than penetration. That means from the foreplay, and then from the clitoris. What did you say?
Clitoris.
Yeah, clitoris orgasm. Yeah, that's your term.
So yeah, my question is like, okay, I lived in US. It's totally different world compared to here. So there is a term, once you go black, you don't look back, kind of thing.
Yeah.
So because people think black people has
Big.
African Americans has big dick,
Uh-huh.
which is not true for us. But like, why women, like, is it doing sex with like a big dick? How do I say it?
You can say that.
It's like so if you practice with a large size penis, and why don't you go back to like regular size one? And one more thing is, does it increase your vaginal size?
Well, I don't have experience in this.
Okay.
But some of
Of
my
course you-
I don't
of
have
course you don't.
experience in this. But then my girlfriend said it hurts if it's too big.
Some people like it though. No,
Yeah.
see, if you the first time, it probably will, right? The second time, third time, the more you do it, it becomes a thing.
Well, actually,
It's a personal preference.
yeah,
Yeah,
it's
okay.
a personal preference because medically speaking,
Yeah.
vaginal canal can
Increase.
increase,
Yeah.
but it's only for temporary.
Okay, so it comes back to normal.
Yeah. Can give birth.
Okay.
Yeah,
It's a human.
So the main thing is like you need to do Kegel exercises, right? No? How important are the Kegel exercises for the men and the woman both?
It's important for men and both,
Yeah.
and a man and for a woman. For a woman, it can strengthen your pelvic muscles. It can also increase the pleasure because some men say it more tight, and then it can also like when you give birth, sometimes there's some kind of complication and trauma, and you cannot hold your pee.
Urinary incontinence.
Yeah,
You cannot
we call
hold
it
your pee.
urinary incontinence.
Yeah.
And with Kegel exercise, it can improve the symptom. I mean, it can reduce the complaint, and
It also helps you to have orgasm?
yeah,
Yeah, okay. What are the best Kegel exercises that you can recommend you can do?
what kind of Kegel exercise? Well, it's something that I cannot answer because
Okay.
there's no like standard of what is Kegel exercise that really works. What is the movement? And at least I don't know about it. Maybe you know, but
Well, you can exercise it yourself while working. Even now,
Even
yeah.
you
Even
can
there's a
strengthen.
device.
There's devices for it as well.
Really?
Yeah.
So it could train you for from bigger size to really small, to hold it in your in this case vagina. You train to hold this device in some period of time.
Okay.
You know what a Kegel ball is?
Kegel ball?
Yeah.
No idea.
It's something. It's like a ball that combine together. Sometimes it's two, sometimes it's three,
Yeah.
and it get put inside the woman's,
Yeah.
and the woman has to hold the ball for some period of times.
So it makes you like
Yeah,
pelvic
The muscles.
Yeah.
Yeah,
muscle,
yeah.
It's
Contract
like working out your
yes.
body,
Yeah, yeah,
like your,
Yes.
yeah. That's Kegel exercise.
Okay. So I feel what I know is like breathing in, breathing out. Like when you hold your pelvic muscle and breathe in, breathe out. That's
Yeah,
one thing I know.
Well,
like,
it's contracting your muscles, same
Yeah.
as like this.
yeah. Like what I do personally is that I breathe in, hold the muscles, pelvic muscles,
Yeah,
and slowly breathe out.
Yeah.
What matters is when you hold the muzzle. It's not about the breathing technique, but the holding
duration.
technique.
It's like at least hold 10 seconds.
Yeah.
That's what I heard.
Yeah.
Can.
So if you do that like 30 seconds a day or like whatever, it helps at least a little bit. That's what I heard. Well, what about we talked about orgasm, we talked about STIs, and how important the sex education for here the kids, like, and also the one of these things is like there is not a lot of personal toys you can get here to use it because
it's still
it was seized.
The
one of the reels I seen is like it was seized like too many
in the news. Yeah.
So like then how do you figure it out? Like there is no, I mean, also porn doesn't actually tell you what is the truth because there is no such educational videos here to watch, first of all. And the porn actually tells you the wrong truth because that's how it is. That's in even movies and everything else, right? And also, if without having toys, how do you figure it out?
Okay. Well, in this era, there are a lot of proven what do you call it, references from social media. There's a lot of NGOs that make contents in social media for reproductive health, STIs. What I know is in Indonesia, there are lots like test Jakarta. This is in Indonesian, right? Halo DKT. In Bali, there's Yayasan Karti Praja. They deal with HIVs and the government is now launching a new initiative on PrEP, pre-exposure prophylaxis on HIV. So there's a new drug. Well, it's not new, but it's quite new in Indonesia.
Okay.
They bring this in. It's for preventing HIV.
So everybody takes it before?
No.
Okay.
For now, it's a pilot project from the government. It's only for key populations at risk. So maybe sex workers, trans women, men who have sex with men. And these can be accessed freely by Indonesian citizens.
Okay.
Only
Indonesian
citizens. In Bali, there's some places to get that, including Yayasan Karti Praja.
So if you decide on taking this pill, you go and take it. They're not forcing you to take like an injection or anything, but it's if you want to do it, take it.
If you're in the high risk population to get HIV.
Okay.
Yeah, it's
what about this good thing you mentioned about same sex practice. So how is that here, like in Indonesia?
In terms of what?
Like, I mean,
criminalized or
it's not US. It's normal. It's
okay.
Europe. It's normal. It's here is something even happening, but like it's not like it's not legally okay.
You cannot legally be married same sex here in Indonesia because it's a religious country. But the movement for awareness, destigmatized, is improving a lot.
Okay.
There's including the PrEP. It's also the government's effort to help this to be a better country.
Okay.
So.
The first country in Asia that legalized same-sex marriage is Taiwan. You know about it?
Yeah, Taiwan. No, I don't know.
No,
Yeah.
it's Taiwan, the first and the only country legalized same-sex marriage in Asia. In terms of Indonesia, it's still since Indonesia is really conservative and it's really religious, I don't think
it will happen.
It will happen. Yeah.
Okay. Is there anything really important that in future it should be beneficial for sex health in Indonesia? You guys think?
Okay, for me, sex education is really important because it can help your life. It sound extreme, but in real case, there's a couple that get divorced just because they don't want to talk about sex and they don't want to be open. In terms of, for example, the woman cannot get orgasm and
Not sex compatible.
not sex compatible. That's the term.
So, okay.
It can prevent just when you know the education enough and when you really open each other. For example, for the orgasm, in my case, my partner is not really talkative about sex. Since I am a sex advocate, I teach her a lot, and we try sex toys, and it really changed our sex life. It really improved our sex life. I mentioned before, only 30% women that get orgasm from penetration. The 70% is also from sex toys. So it's really important for you to open up with a sex education. Nowadays, it really common. There's so many like expert in Indonesia. We have that really famous sex expert like Dr. Boyke. He is a obstetric and gynecologist. And there's a lot of like sexual health advocate like Dr. Michelle, like me, that really give, at least we try to give the right information. So searching information of sex from a porn is really, for me, it's really, how can I say it? It's really make me confused. Why people have to go that far just for a sex education? That's something that drives me to make a sexual education content.
So there is no other way you can get the sex education other than school systems or like, of course, the porn.
The school system? How about the school system?
No, it's a big homework for us all. It's from government. It's a
effort.
Multiple effort. It start with the family, as I said. If you want to be a parent, you should educate yourself as well. You don't just give birth, have kids. You have to learn how to educate your kids as well. What value you want to bring to that family as well, and others like doctors, healthcare workers in Indonesia as well. We need to destigmatize these patients that come to us. You don't in your mind when a patient comes with an STI, oh she's naughty, she's been around. Like that needs to change. And the government as well, they're trying so hard with the new policies and laws, but the implementation cannot be that simple. It cannot be that the Indonesian citizen cannot really receive that as is, if you can say that.
Okay. And how about the family having the talk, like the father having a talk with the male kid and the mother having the talk with the female kid?
What I learned is there are things that you can say to your kid based on the age groups. So you don't teach your kid 2 to 3 years. You cannot teach them about orgasm.
Of course, like when they reach the puberty. Then
even if it starts at an early age, like consent. You teach your children
about consent,
like people who can touch you.
This is one of the things, like how important is mutual consent on sex.
on how people can touch you and on body parts that people can touch you and not, and only maybe only your mother can touch you, only doctors can touch you, some simple like that.
Yeah.
It starts early.
Yeah.
There's stages in that.
Do you get sex education from your parents?
Oh no. Even my sex education was in high school.
Yeah.
The teacher said that you can get pregnant just by sitting on a man's lap.
What?
That's not true, by the way.
Yeah.
Yeah, in Indonesia, regarding the sex education from our parents, phew, you know,
Asian parents.
especially Asian parents,
Asian
you know.
parents.
Because I didn't get a sex education.
Yeah.
I didn't get, my parents didn't tell me anything. I learned just by myself.
Yes, we all.
Yeah.
We all did.
Can we address you as an Asian also, right?
Yeah, I am South Asian.
Yeah, that's why because you know, education from sexual education from parents is really important, because it's only sex education is only a matter of times,
Yeah.
whether you get it from your parents or you get it from the
Making mistakes.
the making
Making
mistake
mistakes.
or a false information.
Yeah.
Because the first information that you get, it determine your future perspective about sex, you know.
Yeah.
When
It
you-
also affects your life.
Yes.
Like, imagine if you get a girl pregnant
Mhm.
at a very young age, it affects the whole your future.
Or imagine if you watch porn and then you think that is the normal size
Yes.
of a
The
man
expectation.
can have,
Yeah.
what he will feel,
The insecurity of the
yeah.
person. Yeah.
And of course the boy will not talk openly about this and keep it inside, and it can ruin their
Sex relationship.
not only sex relationship, insecurities,
Yeah.
self-image,
Yeah.
and it can, you know, spreading to another aspect of life.
Yeah. So without having all these problems, it's very important the parents or like a school system teaches you that before in hand, that it won't happen to you, mistakes
Yeah.
or failures or like future effects of your personal health and also physical health.
Actually, I have a question, since you are from US, right?
Yeah. No, I lived in
You
US
are
such a
raised
long
in
period.
US, right? Is there any like CPR? Do you where did you, when you are high school?
Yeah.
Is it on US?
No, I went to high school in India.
Oh,
I went
in
to
India.
I did undergrad in the US.
Because I heard that in US you are taught CPR
Yes.
since high school.
Yeah.
As simple as that.
In Indonesia, even the grown-ups don't know what is CPR.
CPR is where when a person having a heart attack, right?
Yeah.
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 And how to palpate.
Yeah,
that-
yeah.
Yeah. How to not only heart attack is like any
Just
kind
a
of
cardiac
yeah.
arrest.
So-
That's the difference between educational system abroad and the educational system here.
Yeah.
Even though CPR is really important, it's not taught to our kids.
Yeah.
That's why
There's a lot of- there's a
Dr.
lot of
Michelle
work.
said a lot of homework regarding the educational system, especially in sex education.
But also, do you think these days it's most of the people learning a lot of the things from YouTube? Right?
Yeah.
So YouTube is became very important tool for education now.
Yeah.
Instead of depending on the government education system or the private school education system, the parents should let the the kids
Learn
to learn
together.
online together. Even the parent putting up this is how you learn CPR.
Yeah,
Put
yeah,
up the video. You can learn multiple steps. That is why social media is very influential these days to the people, because it's easy to learn anything these days,
Yeah.
and it's easy to learn negative things also.
Yes.
Yeah.
It's a
Um,
double-edged
yeah, so there is a beneficial thing for this social media and YouTube. I think parents play a big part in this thing. It's like, let your kids learn, because I interviewed a 11-year-old kid. She rescues dogs. She learned most of the things about dogs online. She doesn't know anything about dogs. Now she takes care of like 30, 40 dogs. So if she could able to learn, anybody could able to learn. And most of these kids are very smart.
Yes.
Like, when did we learn about phone? Like, about like 20 years. Like, now the kids, like 2 years old,
Yeah.
she know how to unlock the phone. I'm like,
Yeah.
so it's easy to learn a lot of things, and I think don't just sit on blaming on the government or the school education. I feel like if you want your kid to learn a lot of things, I would just recommend to go online, and everything is very accessible, right? So I think YouTube has everything
Yep.
these days.
Everything
Except-
is in your hands now.
Yeah, everything, even about sex education, it still has online YouTube. Not the porn sites.
But you have to filter the right information and the
Yeah,
wrong one,
yeah,
right?
you gotta make
You gotta
sure who
filter.
is like, if don't just go by listening to someone,
Yeah.
right?
Yeah.
The specialist, there is specialist for everything. Like you guys are specialists, so I would rather watch your videos than somebody else talking about sex. You know, if I'm talking about sex, don't listen to me. So because it's experience based rather scientific based, right? So I would rather listen to scientific based than experience based, because experience differentiate from person to person rather science.
Mhm.
So is any advice you guys have for the listeners?
Educate yourself.
Yeah, it's been talked previously as well. Yeah, just educate yourself. I don't know what to say anymore.
yeah.
If you want to orgasm, just
Explore yourself.
explore yourself.
Experience. Yeah, how important is masturbation also? Like for ladies, figuring out the orgasm is very important. Also doing your own figuring out like for the men, like how important is masturbation, and does it actually affect your performance in the bed?
You have to know that masturbation, it is a sexual activity, but it's not the same as sexual activity.
Yeah.
You know,
Yeah.
I put it this way because scientifically speaking, when you have sex with a real person, there's a phase that you will get. For example, there's a latent phase and then the peak phase. And in terms of masturbation, there's no latent phase, and you will like get how can I say it, used to with the masturbations, and it can ruin your sex life if you will do it exaggerately.
Okay, if you keep on doing it, it will affect your sex life.
Yeah.
Okay.
It can ruin your sex life.
So you're saying don't masturbate?
Don't do it exaggerately, you know.
Okay, don't do it like, what do you say?
Excessively.
Excessively.
So what is the normal scale? Like once or twice a week, or?
There's not a really fixed indicator for that, because there's a varieties of people that have their own, you know, criteria.
Do you
But
think-
there's a sign. For example, if it controls you, if it, you know,
It
if
affects
it
your daily
affect
life.
your daily life.
All you think about is masturbation.
Oh, okay,
Yeah.
okay.
And masturbation is closely related to porn, right?
Yeah.
Okay.
Your standard, your expectation is from the porn, and
Okay.
then when you do it with a real partner, it will affect you.
Okay. So
I
the
have-
perspective of how
Yeah.
you look at the things, right? So, but does it affect premature ejaculation?
It can cause as well the erectile dysfunction, right?
Yeah.
Because it's psychologically related as well. As I said before, the masturbation closely related to porn. You're psychologically tied to that porn, and then when you do it to a real partner, you cannot get erection
Okay.
Not premature ejaculation, but erectile dysfunction.
dysfunction.
So you won't get any premature ejaculation
Oh.
cause of your.
There are a lot of causes of premature ejaculation.
It's not the main cause.
How do you treat premature ejaculation?
Most of cases is lifestyle changes.
Yes.
Surprisingly,
It's
Really?
true.
smokers.
Okay, smoking. Okay. One.
And then some
Porn.
cases is because of it's more psychologist
Okay.
rather than organically. So many cases is because like trust issue, like insecurity, like has a bad experience, trauma. So you have to think about the psychologist side also.
What is a premature ejaculation? What is the duration as an average time, and like you call it premature ejaculation?
Okay, let me ask you this: what is the normal duration of sex?
I don't know. I have no answer for it. Sometimes it's longer, sometimes it's shorter.
Okay, actually, medically speaking, it's around 7 till 10 minutes for the intercourse.
Okay.
So
just the intercourse itself, not the
just
oral.
for the intercourse, of course.
Okay.
For the penetration. So if you do intercourse and then it comes out or ejaculate below the 2 or 1 minutes, it's called premature ejaculation.
Okay.
So it cannot provide the average time of normal, something that we considered average or normal duration of sexual intercourse for the penetration.
Okay. So anything less than 2 minutes is premature.
It can consider premature ejaculation.
But if it's like, even if it's less than 7 minutes, it's still considered premature ejaculation. No. It's the average time is 7 to 10 minutes.
Right? It may be your partner is really hot that time.
That's a different story.
How important is oral sex?
It's for foreplay.
Yeah.
How important is it?
How important is it?
Important.
Because woman is, as you said, 30% people come just by penetration. Like orgasm by penetration, because it should be very important, right?
Well, it comes back to personal preference as well.
Yeah.
Some people doesn't mind oral sex, but some people maybe don't want to do it, and it's okay.
Okay.
Yeah.
There is no importance to it.
There's something interesting about it. If you ask expert, especially something that related with sex, for example, obstetric and gynecologist and then andrologist, some experts not advise oral sex.
Okay.
Because some experts.
Why do you think?
Because it can how can I address it? Because some of them say it's not a normal thing. It's not a nature thing. And some experts say you can spread disease.
From oral. Okay, yes.
Yeah,
I understand.
And some people think, I cannot get STI just from oral sex. No, you can.
You can from the mouth. You can. Yeah.
And but for me, I think their opinion is sometimes biased because they talk not just based on their professional side, but also from their religion side,
cultural side. Yeah.
If you ask about oral sex, in my personal experience, because I like it,
okay,
and I like to do it oral sex to my partner, because I know that's something that can make my partner orgasm, and I think she likes it. It's really important for me, at least.
This is one of the things is that like it also passes STI because you can't protect your mouth, right? So how like I know it is not something you can control, but
that's why some condoms have flavors. Actually.
Yeah.
But
no. I mean, like, imagine for a man you can wear it, and
for a woman,
dental dams.
Huh?
Dental dams. For lesbians, they sometimes use dental dams. It's like also
like a cover.
Latex. It's like a tissue from latex.
Okay, so you just use it for women's side.
If you cannot, for some people that cannot access it, they modified the condom. They cut it,
and they just lay it on top of it. Oh shit! Okay.
Something that you just know.
Something new again.
Dental dams, boys. That's something I learned today. Because it's because STI can be passed through your oral sex. So how do you control it? For men, you use the condom and you can do it on top of it. But like for the ladies, dental dams, boys. On the description. Please follow Dr. Joan. Dr. Michelle. Make sure to go to Dr. Michelle's clinic when she opens up in Karabokan. If any clinic in Karabokan, Seksual, that's her. Thank you for being here. I really appreciate your advice on all the sex education, how important it is to learn and how important it is to put out there. And also for me, I learned a lot of it. Really, thank you. And you guys take your time and came here too, and do it for free, this consultation would have charged me a lot of money. So I don't. And also, one more thing I want to ask: how is the health insurance here? How many people has it, and how important it is?
For Indonesian, they have BPJS. It's a government funded
national health insurance.
National health insurance. And they also have a private insurance, but BPJS is a good insurance here for the basics.
Okay.
And for foreigner insurance, in this term, sexual health, I don't think all of it covers the sexual health.
I mean, just for general health, which insurance should be get by foreigners or
for foreigner?
Everybody, right? So even Indonesian citizens. Which is one, not the government provided one. It's only basic.
Okay.
To get a better one.
I recommend to get both of them actually.
Okay.
The private insurance and the national health insurance, because national health insurance is mandatory. Just I borrow what Dr. Michelle says. It covers basics.
Yeah.
But if you want to go get the length or the best treatment ever, you can cover it from the private insurance.
Okay. Thank you. Thank you for being here. And please subscribe and comment. Let us know what kind of interesting topic we should talk next. And see you guys next week. Sampai jumpa.
Bye-bye.
Bye.